Good afternoon. Welcome to day 369 at the EMA office, joined with the chairman, Mark Kern, who's had a busy day today, and Randy Randolph, the operations manager here. The call center's been busy, and we have some numbers for the followers today.
Yes, it has been busy. The staff is working tirelessly to answer each and every person's call, but they're doing a great job at it, so we thank them for that. For the St. Clair County totals today, we've tested 301,731, and that is an increase of 1,002 since yesterday. For positive test results was 28,872, and that's 43 new positives, both males and females under the age of 10 to their 70s. That brings our daily county positivity rate to 4.3%. 272,859 tested have tested negative. We've had good news today, which there's no more deaths, so we remain at 462. But as always, our thoughts and prayers go out to those that have lost their battle with COVID-19. Those that have completed the IDPH required 10-day isolation period is 27,927. For state totals, they've tested 19,299,281. Positive test results was 1,213,765, and that's an increase of 1,655 since yesterday. For deaths, the state is reporting 20,988 deaths, which is an increase of 17 since yesterday. And again, our thoughts and prayers go out. For hospitalization numbers, those that are currently hospitalized in St. Clair County with COVID-19 or COVID-19-like symptoms is 37. Patients on ventilators in the county is 7. For regional numbers, 58 patients are hospitalized due to COVID-related illness, and 9 are on ventilators. For our congregate living facilities that are in outbreak status, we will only announce the changes, and today we only have one change. And keep in mind that these are cumulative numbers. For Cedarhurst of Shiloh, they're adding 1 additional case, bringing their total to 29 cases and 0 deaths. Chairman, I'll turn it over to you.
Thanks, Randy.
Thank
and
you.
As always, we encourage people to keep getting tested.
Yes.
The testing location again?
Yes, St. Clair Square Mall, they did announce today that they are adjusting their hours, and we posted that information up on our Facebook page for everyone to be aware of that information.
Great. Thank you.
Thank you.
Okay, let's take a look at the zip code report. But before we get there, we want to wish everyone a happy St. Patrick's Day. And for those of you who are lucky enough to have a birthday on St. Patrick's Day, happy birthday. Here's the zip code report. In 62201, up 1 to 569. 62206, up 4 to 1,291. 62207, down 1 to 581. 62208, up 2 to 1,623. 62220, up 3 today to 2,069. 62221, up 4 to 2,774. 62223, up 1 to 1747. 62225, up 1 to 139. 62226, up 4 to 3188. 62243, up 1 to 769. 62258, up 3 to 1,044. 62260, up 1 to 797. 62269, up 6 to 3,248. And 62285, up 2 to 564. 43 new positives, 1,002 people tested, brings our county positivity to 4.3% today. And the rolling average then is 5%. Regional positivity is down to 3%, and that's derived by Bond County at 0, Clinton at 9%, Madison County at 3.5%, Monroe 1.7%, Randolph 1.9%, St. Clair 3.4%, and Washington County 4.2%. So Herb, I think rolling average down, daily county positivity is also down today. Those are good numbers. We had a call with the governor's office today, and in the next day or so, there'll be some announcements coming from the governor, but basically, what the governor's office is saying is what we've been trying to relay. So the mitigations now are going to be hopefully rolled back based upon the number of people vaccinated. And that's why we've been pushing vaccinations. That's why we have what I would argue is the most successful mass vaccination site in the state. We're rolling good numbers through. People are getting vaccinated. They're getting those shots in arms. And that's what's going to lead us to get our lives back to where we want them to be. So the governor will be rolling out percentages of here's the number of people above this age limit that need to be vaccinated. If we meet that goal, then we're able to start to roll back whatever mitigations are still remaining. But the whole thing is based upon the fact that our numbers don't start to go up. And that's why we're saying, and the governor continues to say, the mask mandate is going to stay in place until the CDC says that the masks can be removed. Because the masks, washing your hands, watching in that social distance, are what are keeping our numbers down. Now, we're starting to see these hospital numbers go up. And we saw in St. Clair County, we saw the ventilator number go up again today. That's concerning to us. So let's not let our guard down, number one. Let's continue to see these numbers go down so that we don't hurt ourselves. And let's continue to get vaccinated so we can meet these benchmarks for the state that allow us then to just get all the restrictions lifted and get back to normal. So in the next couple days, specific numbers will be rolling out. And I think you're going to find that St. Clair County is doing a good job to meet the metrics as they're announced. We seem to be well in line with what is expected throughout the state, if not above what most counties are. But it's going to be important that we keep our numbers down. And when I see hospitalizations up to 37 today from the fact that we were in the mid-20s just a week and a half ago, we need to just be vigilant, and let's make sure we're doing what it takes to keep our numbers low.
Well, from the numbers we saw today on the testing site, our mass site is the top as far as getting the vaccines done. We've got another 2,500 doses going out tomorrow, scheduled for that. So for all of those of you who got an appointment, please show up and get that needle in the arm, because as the chairman said, the more people we can get vaccinated, the more we can get our life back to normal. And like I said, the health department, the stats that Mila sent over today shows our site being very productive, and that's what it's all about. Team St. Clair, good news from IDPH and the governor's office. I'm glad you were able to attend that, because we're all waiting for the day that we can get back to some sense of normal, but we can't let our guard down, as the chairman said. Hospitalizations, if you reach the point where you're going to be hospitalized from this COVID, that's really alarming, and we should all be very careful about that. So we can't let our guard down. Everybody is doing the best they can. We just ask that everybody just keep pushing forward and just let's all stay focused, and then we will get through this. And once we receive the official word from IDPH and the governor's office, we'll have any of that information put up here, and everybody will be aware of that, because you're all in it with us. So we're all going to get through this together. We don't have Cindy with us today, but we will be back tomorrow for day 370 here at the EMA office. And if we have any more information, we'll be sure to get it to you. Everybody have a good evening.
We in the medical profession continue the daily battle against COVID-19. One thing I know for sure is that masks do work. Until a vaccine is available, we must ask for your assistance in slowing the spread of this daily virus. 3 simple things help tremendously. Wear a mask, wash your hand, and watch your distance. By practicing those 3 basic principles, you can help us in the medical community respond and defeat COVID-19.